right, good afternoon. I'm going to go ahead and get started because we can either do the abbreviated version or the full version. I was joking with Adwa and Jamel yesterday. They were saying, "Do you have your slides ready for the talk?" And I said, "Oh, do I need them? I really only need one. This is, I will give you a precursor, a bad dad joke." I said, "The state of the Mailman Center is Florida. We're done." So I like that. Some people actually laugh. And can I introduce you to my adult children? Those of you who don't know me, I'm Danny Armstrong. I'm director of the Mailman Center and Senior Associate Dean for Child Health here at the School of Medicine. And this is one of the days that I look forward to. It's actually my second favorite presentation and day that I get to do here. The first is Art Abilities. And if you have not attended one of our Art Abilities ceremonies, when our children with disabilities get recognized for the artwork that is hanging all over the center, it's one of the most touching and inspiring times that we have. But I enjoy this because it gives me a chance to share with folks the progress that we're making, the success that we're having, and to really kind of think about what is the framework for what we're all about as the Mailman Center. So this is about the third or fourth or fifth time or more that I've had the chance to do this presentation. So we'll kind of run through it. I always like to start with our vision statement. And those of you who have heard me say this probably more times than you want to, I've never been a vision and mission statement person. I've worked with a lot of organizations. Typically what you do is argue for 6 months about whether it should be of or for in the statement. But this one just came out of our strategic planning process in a very strong way, and it's been simple. I've had other national organizations wanting to know if we've copyrighted it, because could they borrow it, could they use it, and haven't copyrighted it, but they can't use it. Our vision is to improve lives through innovation, impact, and connect. And the one thing that we will talk about today is, as you see where we've gone and what we're doing, is we need to ask ourselves about everything we're doing. Are we doing these three things? Are we, four things actually, are we improving lives? But that's the reason. You guys can come and sit up, and there's seats up here. And if you come up here, I won't ask you questions. Stay there. But our big things to do are we improving lives? Are we always being innovative? Are the things that we're doing having relevance and impact? And are we doing it with other people? And if we think about those principles about every program, every new project that we do, we're actually going to be in really good shape. We have a mission statement that goes back. It's really comes down to 5 points: address, develop, identify, integrate, and educate. What I want to do is to start today is to kind of go over with you some of our success this year and look at trends where we've been with the Mailman Center. And the first place that I want to start, because it's the tool that allows us to do everything else that we do, is how are we doing in terms of our funding? And as you can see here, over the last 5 years, the Mailman Center has leveraged over $126 million of local, state, foundation, federal funding and philanthropy. Which is a really incredible kind of piece. That puts us among the top 3 centers and institutes at the University of Indiana, and certainly at the level of probably the only other 2 large centers like the Mailman Center that have this level of impact would be Kennedy Krieger at Johns Hopkins and the Weissman Center in Wisconsin. And so we really are looking at one of the largest, most impactful, from a financial perspective, centers, certainly in the U.S. and by virtue of that in the world. As you can look at the funding that we've had this year, our total funding was about almost $28 million. And you can see that that's our high point for the last 5 years. So we've seen these. You have some little dips because a grant ends and we get a new one and those kind of things. But we're hovering above 25 million, almost 30 million a year. And I think next year our total leverage funding will actually exceed 30 million. So we're doing really well with that. When you look at the lines at the bottom, we've been doing very, very well with our local funding and those faculty who have led initiatives with the Children's Trust have really been driving that. That's the bulk of our local funding. We've done very well with state funding as well. Our federal funding has been, we had a high point in 2014-15, and then for the last 4 years, while we're doing okay, we're kind of stagnant. And I'll come back and talk about that in a little bit. We're hovering right around $5 million a year in terms of federal funding. For us to have the coin of the realm for a center or institute at the university and in other push, that's a number that we need to really drive up, and we'll be working hard on some plans to do that over the next couple of years. But by and large, I think you can see we've got stable funding. I try to work with everyone to have our funding at the Mailman Center be sort of like your mutual fund for your retirement account. Wide divestiture in a number of different things, so that something falls, something else goes up, and you don't crash. And it actually has worked fairly well with us. So I want to make sure that I acknowledge all of the folks who are contributing to this work. Alan?
Danny, is that total cost including indirects?
Yes, that's our direct and indirect cost.
Danny, where does philanthropic
fit? It falls into the other category.
Oh.
Yeah. So we have endowments that have been established for the Mailman Center. The corpus for those endowments is almost $20 million a year. The university allows us to take a percentage off of those in terms of distributions. That's about $600,000 a year. That's a lot. It's not enough to do everything that we need to do, but that provides us with some stability and flexibility. It helps us fill holes when somebody's grant goes out. It helps us to invest in some of our programs. It helps us to be nimble. That's an area that we really are going to be focusing on growing over the next couple of years, because that's what gives us the long-term stability as a center. Make sure I hit the right thing. When we put all this together, to have a portfolio of that size with all the things that we do, we went through our organizational restructuring about 4 years ago. And it's a fairly unique model. I do have to tell you, the folks at the Wasteman Center in Wisconsin heard our presentation about our reorganization at AUCD a couple years ago, and the director up there has been a friend of mine for several generations, it seems like. And Bill called me and he said, we presented your idea to our staff, and we only had to have 3 ambulances come for the heart attacks that our staff had as they heard about what we're doing. We've kind of gotten used to it, and it's been a very big impact for us. And that was our focus on interdisciplinary, interprofessional collaboratives built around themes with our leadership and full participation by folks across the center, but also, as you'll see in a little while, across the university in these particular initiatives. And one of the things that we can say from a financial perspective is we've seen about $1 million to $1.5 million of new dollars that have come into the center each year incrementally since we did the change. And so there are grants that we would be well below that $25 to $30 million range without the kinds of incremental jumps that we've had because of this. And the model is a really exciting one that to work. We've got our 4 interprofessional collaborators, the IPCs, with their specific focus, and then we have those cross-cutting initiatives that are led by key leaders in the center in the areas of research and training, community engagement, and innovation, and clinical care. But what we also did was recognize the strengths of some of our major service demonstration clinical programs, the Debbie School, early steps, the pediatric mobile clinic, our child protection team, as foundational basis for us to be able to use with each of the IPCs for research purposes, for being able to come up with best practices, for being able to translate those best practices into the community setting. And so the model seems to be working. We're always open to tweaking. It is radically different, I can tell you, from the way that most other centers like the Mailman Center operate around the country, but a number are starting to think about being like Mike, to use the old Michael Jordan commercial from years ago. When we look at what we've done, I like to look at what our work for the last year has been, but it's really important to look at things over multi-year periods. And so most of the data here, I'm going to kind of show you what our trends are. And when it comes to trainees, we're hanging very nicely, typically somewhere between 70 and 80 long-term and intermediate-term trainees each year. The important piece of this slide that occurs year after year after year is the blue. And those are the number of our trainees who come from minority backgrounds. And Jeff has looked at this, and we are incredibly unique in leading the nation. Those blue numbers account for 25% of the minority trainees in LIN and USED programs in the United States. I'll say that again. If you take all of the minority students being trained in the United States, 25% of them are here at the Mailman Center. That says the other people aren't doing a really good job. It also says we live in one of the most culturally rich environments in the world, and that is one of our major assets. When we look at what we're doing in terms of clinical services, a similar kind of thing pops up. We are seeing somewhere between 12 and 15,000 children a year, some of them for multiple visits, some of them for unique independent visits for a variety of things. We also don't see them here at the center. This accounts for folks that we see here at the medical center, at the Mailman Center, but it also accounts for those children that we see in community programs, in outreach, in collaboration with other groups, in some of our major programs that are community centered, and I'm very, very happy about that. The other piece of it is, as you look at this, is that we're, again, running somewhere around 75% of the children that we serve with intellectual developmental disabilities and other special health care needs are of minority backgrounds. That's partly the unique component of our community, but it's also a really testament, an outcome of our commitment to serving this community and being experts in the area of cultural service. When we look at annual community training and technical assistance activities over that 3-year period, you can see that 2016-17 and 2018-19 were pretty comparable. You know, typically around 60 events, and typically somewhere between 3,000 and 6,000 participants each year. We had a banner year last year, but I think we had a whole host of small events that were serving a large number of folks. But this is a critical piece. It's a requirement of our USAID grant, and we're doing this incredibly well. When we look at our research program, there are 3 things that we're looking at. Are we designing new studies, and are we activating new IRB protocols? And I think, as you can see here, we typically are adding 7 to 12 new research protocols each year here out of our faculty and staff, and that's an important component. We also then wind up having somewhere between 40 and 70 projects going on that aren't new. They're a combination of the new, but also the ones that are ongoing studies. And so that really speaks to the robust environment that we have here. And we are typically submitting around 30 to 40 grants a year. You don't get a grant if you don't submit it. Typically, the ratio of grants awarded to grants submitted to somewhere in the 20 to 25% range across all the types of services we have. And that really is inflected. We actually have a pretty good success rate in that respect. And so continuing that process of submitting grants is one of the ways that, A, we have financial stability, but we also push our innovation and research. The outcomes of our work are really important. It's not enough to just have a protocol, but to actually do something. It doesn't exist if we don't disseminate it. And so when we look at the number of funded projects that we have at the center, the ones that we've submitted those grants, we've gotten them funded, they're either new awards, they're continuation awards. We're hanging around 70 this year, up to 79 funded projects center for our various participants. Our publications are concerning, and we will talk a little bit about how we better capture that. I don't think that we've stopped writing papers. I think we are having a problem capturing our papers, because you see we had 194 publications 2016-17, and for the last 2 years we've been running around 25 to 30. So that it is important, though, for us to publish, and we have to be able to really think about how, with our trainees, with our staff, our faculty, that we really begin to move the good things that we're doing here into written form where we can publish and other people can use and engage with that activity. Because again, if we don't publish it, nobody knows about it, and it also didn't really happen. We are also hitting 50 to 55 to 60 presentations at regional and national and international meetings every year, and so we are getting out there, and that's a number that is good. It's probably not as high as we need to, because we haven't had a lot of travel funds. Our ability to pay for folks to go to conferences is somewhat limiting, but we're still hitting some nice movement there. One of the big research impact pieces that we've begun looking at about 5 years ago and is how often is the work that we publish being cited by other people? And when we think about the activity of doing the research, and then there's the activity of how many do we publish, the really important thing are other people looking at that and saying, this is important enough for me to cite in my publication in this particular area. And so that's the way we are driving things forward. And as you can see, we were about 250 in 2016, almost 400 in 17, 18, and we have 127 this year. Those really kind of reflect maturity of publication. So these are citations over the last 2 years for faculty that have published papers. And we're going to be continuing to look at that citation impact, but that's a critical feature of the real impact of what we're doing in our research field. Let me shift to some other kinds of issues, because when I came to the Mailman Center now 35 years ago this September, there was this iron wall between the Mailman Center and the child health divisions of the Department of Pediatrics. They didn't cross. We were essentially the Mailman Center was our interdisciplinary evaluation team. Actually, at that time, it was a multidisciplinary evaluation team with some research that was going on. And I will say that in 1999, when I took the role as director, our former interim director sat down with me and she says, you have these 3 grants. They totaled a little, and then a couple of contracts, and the total funding was about $5.5 million. So to give you a perspective of where we've come in 20 years, we were at about $5.5 million in 1999, and now 20 years later, we are almost 30. So that's pretty good growth for a program. But she also said you have $20,000 in something called a grant-related income account, and the administration don't know that it's there, and so don't tell them you might need it to pay your salary one day. That was the perspective of walking into the center. And so we were really isolated, and people thought about us as a small group of people who worked in the multidisciplinary team here at the center, or it was this concrete building that folks walked by. Well, today that's really different. We're still in this concrete building. We've done some renovations, thank goodness, but we are truly a matrix center of the university, and we are one now of only 2 centers at the University of Miami that are federally designated. And the Cancer Center finally caught up with us about a month and a half ago with their NCI designation. We are actually named in federal statute in the Developmental Disabilities Act of 2000 as one of the designated centers in the United States. And so with that, we have this responsibility not to be insulated into our center, into the walls of this building or just the Department of Pediatrics, but to really be a functional center across the university. And this slide really reflects, to a large degree, the number of departments and schools. And to be honest, every time I look at it, I remember somebody else that I need to add here that we've missed. But as you can see, we're working with multiple departments within the School of Medicine. We're working with other departments in other schools and colleges within the university. And this slide doesn't include other universities that we have collaborations with. It doesn't include other major community organizations, Miami-Dade County Public Schools, the Children's Trust, Miami-Dade County, the state of Florida, and others. This is our connection slide. This is where we really make our difference of being able to show that we are working outside the walls of this building. And I listed this because these are the departments or the schools of the faculty at the university who have self-identified as members of one of our 5 IPCs. It's really a pretty incredible list of departments, and it's one that we can clearly grow. Well, what are our IPCs doing? And this is really hard. I ask all the IPC leaders to provide me with a whole bunch of information, and they send me 3 or 4, 5 pages plus follow-ups. Bridget, thank you for all the follow-ups that you sent. And we get these kind of things, and of course I condense it into one slide and jump right over it, but that's for purposes of presentation. But I think it provides us a sort of the impact of where we are. So promoting behavioral health, Bridget, Julieta, and Raul have taken over the leadership with that. Jason was goofing off. We had to promote him into a place where he couldn't get into trouble. And Bridget and Raul were really great to step up with Julieta to lead this. And our goal here is to develop opportunities for integrated evidence-based behavioral health care. What have we done? What has this IPC accomplished? Very active. They have 6 active IRB protocols specific to the IPC. They have 11 grants. 3 of them are new. Their members have published 16 peer-reviewed papers, 7 book chapters, plus a white paper in the last year. And so they are disseminating what they're doing. And I push this group particularly because the work in evidence-based parent effectiveness training, parent-child and teacher-child interaction therapy are ripe for incredible opportunities for publication and evidence-based implementation grants in the future. Hint, hint to all of you who are working in that area. But we've also seen just a host of other kinds of clinical and demonstration best practice things coming out of the group. And in addition to PCIT and TCIT, the Parent Club, the Coach and Training and Implementation Project, a lot of work in trauma-focused cognitive behavior therapy. We've been asked to join the South Florida Behavioral Health Network in a grant to become the training center for trauma-specific CBT as part of a Victims of Crime grant administered through the Attorney General's office, and we're hoping to hear from that actually very, very soon. But the development of the work on trauma, not only from the focus on helping children, and in particular children, but their families who experience trauma with managing the acute emotional and stress-related components of that, but to think about what is the impact that has on the developing brain And do we see long-term impacts because of neurologic changes related to trauma? There's certainly evidence that's growing in that area, and we think that this is one of those areas of research that will help us to think about long-term impact well into adulthood for these trauma experiences. And certainly one of the things that's been on everyone's mind is what is the impact on those children who have been incarcerated as part of the immigration issue in things like Homestead? Are we going to be looking at brain changes and significant long-term neurocognitive, neurobehavioral kinds of impacts? And we don't know, but it's an opportunity to look at it. We've brought the Early Start Denver model for an evidence-based program for intervention in autism to the center, and that will be really rolling out this year through this IPC. Julietta's working with Georgetown on the pyramid and TA to Puerto Rico. Our infant mental health initiative is growing under this IPC. Families First was one of the first projects funded by the Children's Trust. And I mean, when I say one of the first, they funded several. It was one of those first ones, and it has been continuously funded since that time as a model for reaching out into the community to be able to triage families at risk for abuse and then triage the level of intervention provided to them. And then, of course, we have our behavioral pediatrics clinic, our Healthy Steps program, and the school health initiative. So there's a lot of things going on in the direct service level coming out of this IBC. We have training in TCIT and PCIT. The Jumpstart staff have been trained. We've done 4 national training symposia, deeply involved in LEND, as are all the IPCs. We've had training presentations at the Association of University Centers on Disability, AUCD, as well as collaborations around within and outside of AUCD. And in each one of these last boxes, I'm not going to read all of them. They're up on the screen. What they tell you is how much our IPCs are collaborating, that connections component with community partners. It's also really good to see all the people, faculty, staff, and trainees across multiple departments who are participating in the IPCs. It was a model that we had hoped to expand our reach, and it certainly is working very well. For the community health IPC with Ruby and Maite, again, here the focus is building our capacity for improving children's health in our community with special attention to the health of children with developmental disabilities. Here, they've got 3 active IRB protocols, 8 active grants. 5 of those are federal. They have a Maternal Child Health Bureau, R40, that's been submitted, and they have R01 and a Gerber Foundation grant in preparation and 4 publications this year. So active in the involvement, both in getting extramural funding, doing the research, and publishing it. We have our major programs with Early Discovery and Jumpstart and the Step Up AT program. Those are some of the featured programs for what's going on. They've done an Innovations and Connections Conference in conjunction with United Way, deeply involved in LEND, our infant mental health training program, and Jumpstart. And again, a long list, but if you had time to compare, you would see that many of the community agencies that are part of this community engagement component are different from the ones that we had in promoting behavioral health and in the others. We have about 120 different community agencies across the IPCs that we're working with in one way or another. And again, a nice group of folks from several different departments who are engaged in the work of community health. The neurodevelopmental intervention science with Michelle and Lynn, they have 4 protocols that are active. They've got 9 grants. One of those is federal. They've had 6 publications this last year and 17 poster or oral presentations. They've got work going with Miami-Dade North Early Steps, the Early Discovery Program, the Debbie Institute, Families First. We have the Jasmine Project to prevent mortality in Black babies before the first year of life, and the Starting Smart program. So good impact in terms of program demonstration kinds of grants. Again, in the training and evaluation LEND, they've done an Innovations and Connections Conference. They've had 14 grand rounds or other conference symposia presentations and training. They did AT training for over 1,300 individuals. They've developed 3 online training modules. And they're, of course, involved with early steps. We have a contract with the state to do evaluations of early steps across the state. And this IPC and Dr. Delamater looking at the focus group component out of our research component, really looking at what's the evidence for the early steps program and how can those things be improved. And again, a lot of collaborative organizations, and a number of people participating across multiple departments. Neurodevelopmental Discovery IPC with Bob Pfeiffer and Dan Messenger. Here, and I sent them a note this morning, I think we're not capturing the data from this group as well as we could, but we were able to identify they have 5 grants, 3 of those are federal. They have another one in preparation for application. They've had 8 publications and 22 presentations by their members. They've got funding sources from the National Center for Special Education Research, Autism Foundation, ULINK, National Science Foundation, NIH, HRSA, from the CTSI and Florida Department of Health. We've got clinical and training initiatives in the U.S. Virgin Islands related to Zika from MCHB, and they've conducted a series of seminars, and I listed these in particular because, again, this speaks to the involvement of the center with the university at large. Those presentations have been by faculty in biomedical engineering, in nursing, in genetics, in music, and science. And so it really kind of gives us a perspective of where we're sitting with all of that. And again, a number of things within Florida, but also with the Virgin Islands. And again, a nice list. And I actually hope to see this list double over the next year. Bob and Dan, no pressure. And then our lifespan IPC is with Larry Friedman and Shelley Baer, and this is to develop innovative solutions for challenges of older adolescents and young adults. And no grants or publications, but I'm not going to fault them because they're engaging in some work that is really innovative in an area that nobody else has quite figured out, and that is how do we provide appropriate health care to young adults and older adults with developmental disabilities in an adult world not prepared to be able to provide that care. So they've been collaborating with Special Olympics and are developing a novel program that we hope to be able to open up this year over in the PAC that will be targeted to adults coming in for primary care. If you think about the 24-year-old with autism that has also a severe behavioral component, you can't do simple things like get a blood pressure or even draw labs. And so Matt M. and Larry and others are working on developing a model program, utilizing AT components, utilizing the web for preparatory work, and then setting that up as a model program that we can move out to the community and to other places to increase access for adults. Our group has been very involved in the LEND program. One of the components that's come out of the Lifespan IPC has been the Disability Awareness and Sensitivity in Healthcare program. This actually started with our ETLP group a few years ago in the LEND program as their project for the year. It's now developed into a curriculum. We are doing something differently with this than we've ever done before. We develop a lot of programs and we just share them. Well, this time we've hooked up with the technology transfer folks. We've got attorneys involved. We're developing intellectual property pieces and looking at this DASH protocol as something that we can actually commercially market to other large health systems to help them use in training their staff around sensitivity issues for caring for individuals with developmental disabilities. And so we're really excited about the leadership that Shelley in particular, but with the entire team has had in developing the DASH program. Our SALT and ETLP programs and our SELP program for students for exceptional leadership are all really strong, but certainly SALT and ETLP are big focus of the Lifespan group. They've done an Innovation and Connection Conference, and this last year, just a couple of months ago, we're very much involved at a university level in raising awareness about disability as an area of diversity in our university community. Again, multiple agencies outside and collaborations. It's a small group. They would love to have more, and this is an area for us to really grow. I talked about the SELP and SALT and ETLP, and it's great to have all those little numbers roll off. The ETLP program, the Emerging Transformational Leadership Program, actually started on a couch at the Renaissance Hotel in Washington. Jeff and I were there, and we had to come up with the next 5-year LEND application. And I had made a commitment to myself and to the center when I became director that we were always going to put something in that was innovative and sort of outside the box. And so Jeff and I don't know quite how it happened, we came up with this idea of taking community professionals and bringing them in and doing a year-long experiential and didactic training program around leadership and developmental disabilities. And that started our ETLP program. That evolved pretty quickly into recognizing a similar kind of leadership program could be done for self-advocates. So a lot of the work that was happening for self-advocates in the community was related to their gaining a voice to complain about the things that were happening to them, but not necessarily to know how to do anything about those complaints. And so our SALT program has really been built to develop specific leadership skills that enable self-advocates to be able to move policy forward, to move practice, whether at a local community level or state or national level. And then with our last USAID grant, we added a program thinking about, well, what about high school students, and particularly students who have a brother or sister who have a developmental disability. And so that therein was born our SELP program. And this very complex model over here actually kind of talks about the fact that we've created a pipeline for high school students, for self-advocates, for young professionals, to be able to come through and acquire a set of specific kind of leadership skills that can actually change and have significant impact in the area of developmental disabilities. And this is just a nice slide that shows how those various things are connected with the photographs of some of the folks who are graduates of those programs. The Taft Foundation supported us a few years ago with a unique concept for developmental disabilities. Not a unique concept in the cancer world. We've had navigators, cancer navigators for 15 years. But the idea of having someone help navigate the complex system of services, access, funding structures and the like for families of children with developmental disabilities was a unique concept. Jeff sold that idea really well to the Taft Foundation. Nancy and Maite have taken it off and run with it. And here you can see that the Navigator program has successfully connected 77% of the families that we've served to services. The little graph over their very nice picture there shows that we're serving between 400 and 500 families a year now with the Family Navigator program, and that has begun to reach out to Overtown, East Little Havana, and other community agencies so that they can pick it up and do it at a community level. Again, we're looking at a group that's about 54% English speaking, about 43% Spanish, 3% Creole, about 45% Hispanic Latinx, about 29% white non-Hispanic, 22% African American Black, and about 4% other. And as I mentioned, we've got this stuff really starting to go out into the community, including some oral presentations at national meetings. And I shared this. This is from our group that went to AUCD. Now, it used to be that I would go to AUCD and maybe one or two other people would go to the AUCD meeting, and that was about it. This is our Mailman contingency at AUCD, and everyone there was either presenting or attending meetings or sitting on a committee or something else. So it shows you the level of impact that the center is having at the national level. And I mentioned when we did the Family Navigator about the work that was being done in the whole area of developing a database and systematizing this service. And Allison Kumick, one of our MD and PhD students, presented, and I think Nancy is hiding behind the podium. President Shalala used to always have a little thing she could stand on to get above the microphone. We should have thought about that. But this was at the AUCD meeting. So we're having a great impact at a national and international level. Outside the IPCs, I wanted to just highlight some of the things again that have been done this year. We've initiated the training and implementation of the Early Start Denver model. We've developed communities of practice in north, central, and the south areas of Miami-Dade County in collaboration with WIC around nutrition. The infant mental health training program has gotten off the ground. Art Abilities has had another successful piece and is actually being featured as part of the Art Basel gallery this week through tomorrow, I think, up in the Arts District. And there was an email that went around with the information about that. So if you have nothing to do in the morning or this evening and want to wander in and see our work featured with the best work of the children in the best art festival in the world, this is a really good time to do it. Our PCIT and TCIT programs are expanding, and as they're expanding, they're not just using what's been done before. They're looking at new ways to provide access. They're looking at opportunities to use telehealth and web-based work. They're looking at ways to train in community settings to be able to provide broader access. Our leadership pipeline programs are translating into action. I'll just mention two. I've talked about the DASH program. That was something that evolved out of the ETLP. The other one was from last year that looked at some of the issues about transportation accessibility for individuals with disabilities in Miami-Dade County. And that group has now, they brought in one of the members of the county commission who's running for mayor and have gotten her supported. They've connected with a community agency. They are driving this whole issue of expansion of access to transportation for individuals with disabilities in Miami-Dade County as a function of their leadership program in the ETLP. And so we're seeing those things go from training to action. I mentioned the DASH curriculum. Importantly, not only does the curriculum come up, it got rave reviews and instant acceptance from the leadership of both Jackson and and we're trying to work out little things like legal language over who gets to put a logo on something, and we'll be doing that with our major competitor, Baptist Health System, a little bit later this year. We've had some really significant things. The Project SALT was awarded grant or an award from the Awesome Foundation. We think it's awesome. They did too. Shelley was recognized a few weeks ago at the AUCD meeting as the recipient of the Gordon Richens Award for Leadership and Advocacy. And Jeff received a really significant recognition, the Maternal and Child Health Bureau Directors Award. So impact of our individuals in our program. Our community outreach is core to what we do at the Mailman Center. We are no longer in these walls, and more than half of the work that we do is outside this center and off this campus. And that's a really important piece of where we're going. We made the decision to make the interface between disability and diversity a priority of the center and began working with two communities that were really great partners. We approached this by going in that these were not going to be Mailman Center programs. We had a level of expertise. We've asked each of those communities to help identify what their needs were, and was there something we could bring to the table to help them build capacity to address those needs in their community. And we found great partners in both the Overtown area through the Overtown Children's and Youth Coalition and in East Little Havana with Connect Familias in a very big way. But not just those two organizations. They've been convening organizations for multiple other community-based organizations, agencies within those communities that are helping us to move forward a plan. Now, our goal is not to be in permanent partnership with those two groups. Our goal is to work with them to help them address and build the capacity to address the needs that they've identified. And then as they have that capacity, for us to be able to look at other communities to help with the same kind of partnership. So it is capacity building in the community setting. And we're really excited about that. I'll share a couple of slides from the presentation we did at AUCD a few weeks ago. If you haven't been to Little Havana, this is a great picture. The chicken on the street in front of the restaurant, it is a classic Miami restaurant. You should really go there. They've got great food. I actually had a chance to go there one night with a group of folks that were doing an exchange program. It was a group of physicians from, most interestingly, the Ukraine, a while ago, who were met by our local congressman, Lincoln Diaz-Balart. And just to share the story of this particular restaurant, the mariachis came in and started playing La Volare, and Congressman Diaz-Balart started singing at the top of his lungs, and then the Ukrainian physicians started singing their Ukrainian songs, and so then we had some more Cuban music going on, and then we had some more Ukrainian music going on. It was quite a musical event right here by the chicken. That's my main remembrance of Isla Havana, but this is the important demographic data of what we're looking at. This is a tough community. Median income, $23,000. 34% of the population exists below the poverty level, and 44% lack health insurance. This is where we can come in and really help these communities identify the resources, help them write grants for their communities, and help build capacity to address what are some pretty overwhelming needs. Overtown is similarly, and I forgot when I was talking about the chicken, that's 95% Hispanic Latino in that community. Overtown is our other community. Overtown was a thriving business center owned by Black residents for more than 50 years. And then we built I-95, split it up, and really kind of destroyed the community. And if you were here in the 1980s, we had two major riot periods of time over a period of about 10 years. And Overtown was a place you didn't really want to hang out. Now, it's a stone's throw from here. On a good day, if I tee it up right, I could almost hit a golf ball into the streets of parts of Overtown. So this is our community for this medical center. Demographics, 50% of the children live in poverty here. 69% are single-parent households. There are over 2,000 families that live in the community. 3,500 children between 0 and 19. It has a population of only 13,000, and the per capita income is $14,000 per family. So we really are looking at a low income, again, predominantly about 60% Black African American and another 20 or so percent Hispanic Latino. So minority and low income with limited resources and really significant challenges in the communities. But these are the folks that we've decided to partner with. And so I wanted to share with you what our partners had to say about it.
Hi, I'm Betty Alonso, and I'm President and CEO of Connect Familias. And working with the Mailman Center has been an amazing experience for us. No partnership is without hiccups, but even with the hiccups, we figure out how to come together and co-design solutions that work. Our work around our PCIT work, our work integrating services into the community, and really bringing those services outside of the university so that there is more access for the families, and then integrating that even further with our work with natural helpers, community health workers, has really made a difference, not only in our staff's professional development, I think, and learning, but also in the Mailman's team, as well as with the families. And at the end of the day, that's what we're hoping for. We're hoping for better outcomes for our families.
We appreciate hearing that from Betty, and now from Graylin Swilly-Woods.
I'm Dr. Graylin Swilly-Woods. I'm the Executive Director of the Overtown Children and Youth Coalition. I am just so excited to be a part of the collaboration between the Mailman Center and the Overtown community, because for me it's a perfect model for university and community partnership building. Some of the things that we've been able to do in particular is share resources, engage each other in our grant work and our program work. We've been able to share data among each other. But I think most importantly, we've been able to bridge the gap that the proximity that we have with the university and the community is so close that we've really been able to sort of join hands in a way that hasn't been joined before. And our coalition members, including Touching Miami with Love, the Overtown Youth Center, these organizations have benefited directly from the faculty, from the clinicians, and from the students that have been offered to us. We've been able to do a couple of events and programs that are mutually beneficial to both the organization here in Overtown as well as to the Mailman Center. But in particular, we sit on each other's committees, which allow us to bridge and share information together. I'm a part of the Mailman Steering Committee, and several of their staffs also sit on our Health Committee, as well as on our Working and Productive Committee. The other thing that I think is important is we've been able to share data, which is really one of the things as a collective impact organization we hold to be important, because the data informs us. And so usually people guard that information, but in this case we've been able to share the various outcomes that is happening in particular programs that the Mailman Center. And then we're also able to bring our population closer to understand some of the nuances and some of the culture differences and competencies that we need to work together.
Here, I can't ask for a better statement about what we're doing. Hear it from our partners and from their hearts. I want to just hit on a couple of other things. We are working on our USAID grant objectives related to this interface, and really moving it forward. We're hitting all of our criteria. One of our big issues is developing population-based measures of outcome, because when we are working with those communities, we want to show that we're having an impact on not just the individuals we serve, but on the community at large. I do want to just point out a few of the things that we've accomplished that are, pragmatic. The first 4 clinics here in the building were renovated. They're beautiful. They seem to be functioning very well. It's hard to remember what the elevators look like and when they didn't work. We have workable, nice, shiny elevators. We were able to inaugurate the Tiffany Field Innovation Suite, and I hope that we will begin to see a lot of use of that That room is on the 5th floor in the corner. We ask that you use it. If you can't get in, just come down and see Adwa or catch one of the faculty or staff and get in. It's not a place to go hang out and have lunch. It is a place to go in and say, all right, I'm putting all my preconceived notions outside the door. What can I think about that really is innovative that might make a big difference? It's our place to seed that kind of thinking. We'll be starting the renovations of the 2nd floor clinics, the behavioral and development components this next year. We are adding wheelchair accessible doors in room 3003, right around the corner this next year, and we'll be working on trying to get those to all the fish bowls. The website redesign will be launched in May of 2020, and we're really excited about that because it will be fully accessible in all areas and completely redesigned, but it's going to mean we've all got to do a little bit of work. Jamel back here is coordinating that effort for us because we have to get the content up. And we'll be adding digital measures for faculty data across the university. This is a relational database for keeping track. It's a pain in the neck to get started, and I know I'm going to hear lots of complaints. I've already done mine. It took me a week. I'm so sorry. But once we have it, we'll be able to use a searchable database. Those of you who had to do the reports for me, you'll just be able to pull it out in about 20 seconds. So we're excited about moving into, at least the 20th century in terms of technology. It's important for us to keep thinking about the fact that we're driving principles for change. Innovation means doing things differently, leading rather than responding. Impact is making a difference not only at the individual child and family level, but at the community and population levels. And the connections mean we do things together with both our historic partners and collaborators that we haven't considered previously. There are a bunch of opportunities, and I'm not going to go into these a lot now for time, but we are moving forward. These are repeat slides from the last couple of years. We are now clearly moving forward on addressing health disparities in this intersection. We've adopted communities and been adopted by communities as partners. Our opportunity moving forward is to really begin thinking about how do we create a research mentality around our service programs. Again, we can have the best service program in the world, but if we don't have a way to disseminate, to show that it's effective, to disseminate information about it, then nobody else gets it. I've driven Kathy crazy for years when I say, I hate the Debbie School. Well, she knows I don't hate the Debbie School. What I hate about the Debbie School is that there's only a select number of children who get to be bussed in. There's only a select number of children whose parents actually work here at the medical center that get to take advantage of it. This ought to be a program that you can get anywhere your child happens to be, in Miami-Dade County, in Apopka, in Panhandle, in South America. And we need to make sure that we are translating that information out to the community. We need to be thinking about ways to promote innovative approaches to the unmodifiable social determinants of health. Our new next-gen MD curriculum for our medical school will be really emphasizing social determinants as part of that educational curriculum. And we here at the Mailman Center have a unique opportunity to promote the understanding, but also not just the understanding, the solutions to those issues. And we have to develop our own research plan of how we get to that NIH-funded level. And so we will be having a retreat on this topic in the spring. So where are we with the launching pads? The new annual report is out to talk about what we've done for the last few years. It's on the website. We're sending it to all the legislatures. We're going to be working with the Department of Psychiatry and Behavioral Sciences to initiate the Pediatric Behavioral Health Collaborative. And really begin thinking about our collaborations here driving the future of how to provide mental health and behavioral health services to children in the state of Florida. I mentioned the Model Primary Care Program for adults with intellectual and developmental disabilities. We've got folks working on the platform, the technology platform, to begin doing continuing education programs that can be accessed by people, anybody who has access to the web and a computer. And then utilizing that as a revenue stream to help to support the growth and development of our other programs. We'll be focusing on federal grants in the next year, as well as really refining the way that the types of measures and the way that we collect outcome measures that are population based. And I would be remiss if I didn't give Jeff the nod that the 5-year renewal for the LEND grant's coming up. So we'll be doing our preparation for that. We love doing those. Bottom line, I've said this many times, this is a repeat slide, but I think it's worth saying. The world of developmental disabilities and children with special health care needs and child health in general has changed and will continue to change. We can either be reactive to that change, or we can maintain our status as a leader in using the change to improve the lives of children, families, and the communities they live in through the crucial pieces of our vision statement. We embrace innovation, we strive for impact, and we achieve our success through connections. I want to thank all of you for being part of this mission and doing what you do. It's a great place to work. It's a great place to be the director. I tell people that what I do is that I'm smart enough to get really smart and driven and enthusiastic people and then get out of your way. So thank you for doing it.